asking you to give monies for sponsorship to Vocal Ottawa. This stands for Voices of Canadians About Lyme Disease. This is being held on Parliament Hill on Saturday, June 3rd from 1 to 4 p.m. Lyme disease, if you don't know, is the fastest growing vector means bite-borne disease in Canada. Its numbers are vastly underreported, and patients who go undiagnosed and untreated can be stricken with debilitating symptoms for years afterwards. On Saturday, June 3rd, 2017, in cities across Canada, Vocal will be hosting events to raise awareness of Lyme disease, including galas, walks, and demonstrations. In Ottawa, the nation's capital, Vocal Ottawa plans to make an especially big splash. They will be hosting an event on Parliament Hill and are inviting musical performers, speakers, celebrity advocates, persons living with Lyme disease, doctors, politicians, and researchers. The goal of this event is to raise awareness about this potentially debilitating but little understood illness and unite Canadians across the country that are suffering from it. So by sponsoring our event, you will have the opportunity to join solidarity with Canadians affected by Lyme disease, particularly those living in the National Capital Regions. Funds raised will be used to cover the numerous costs associated with orchestrating this event, such as travel and accommodations for guest speakers, costs of the rental of audio-visual equipment and sound equipment, printing, and much more. By helping with this growing cause, you as an individual or as a company will be in a position to establish a long-standing relationship with a growing cause that will become increasingly important to Canadians in the coming years and decades. You probably are wondering the reason I would be reaching out for sponsorship for this event. I've been in practice as a doctor of chiropractic for 25 years, and when I went to school, Lyme disease was taught to us that you could only get it by traveling to the northeastern states. With the advent of birds, deer, and rodents bringing the ticks across our Canadian border, these ticks that carry Lyme disease are prevalent even in our backyards now. In the Kingston area, it has been reported that over 40% of the ticks carry Lyme disease. Patients have been bitten in the Gatineau Park, and the tick, when tested, carries the Lyme disease as well. I've had neighbors in where I live actually say that their dogs have been bit by ticks in their backyards too. If it's caught early, Lyme disease can, in a number of cases, be aided with a course of antibiotics. However, if it's not caught early enough, this infection can develop into a debilitating condition called chronic Lyme disease. Yet, unlike West Nile encephalitis or SARS, which is known as severe acute respiratory syndrome, where the medical profession and scientists join forces to find better treatments for a cure, many patients who have chronic Lyme are being denied treatment presently in Canada and left to suffer or go to the United States. Many patients are being misdiagnosed with conditions such as multiple sclerosis, ALS, which is amyotrophic lateral sclerosis, rheumatoid arthritis, lupus, chronic fatigue, fibromyalgia, and many other conditions instead of Lyme disease. I have had this hit me close to home, as my partner was diagnosed with chronic Lyme in 2012. It has been a long journey, seeing 3 ophthalmologists, 2 rheumatologists, and having many tests done, being administered corticosteroid drugs that aggravated the symptoms. The chronic Lyme causes cycles of some good days and other times where the flare-ups occur. Because this was not caught early enough, the symptoms will still come and go. We have been to several different what are known as Lyme literate doctors and had some results from the condition, but there will be always lingering symptoms. Just to let you know, Lyme is an invasive bacteria. I describe it such as the corkscrew on a wine opener. It looks like that, and it burrows into the body. into the tendons, ligaments, synovial fluids. The bacteria are able to cross the blood-brain barrier even, and not many bacteria are able to do this. Since this time, in 2012, I have now come to understand how many patients' symptoms are related to Lyme, and have now been sending some of them for the proper specialized testing for diagnosis of Lyme disease. So as a result of this, I've been able to actually diagnose Lyme in patients that were previously diagnosed with things such as rheumatoid arthritis. Often the OHIP testing is not adequate to diagnose the chronic Lyme, so the blood test here in Canada isn't as accurate. So what I'm asking is that you consider giving to this important event, either as a company or as an individual donation. Thank you for considering this request, and we hope to even see you on Parliament Hill on Saturday, June 3rd, 2017, from 1 till 4 for Vocal Ottawa.